Hi everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. If you're watching this video, it means we've now covered more than 30 FDA-approved medications in allergy and immunology on this channel. I want to take a moment to really thank everyone who have subscribed, followed along, and supported this growing channel. I truly appreciate it. This wouldn't be possible without you. Today, we're starting a brand new series focused on an important medication category I have not explored yet: inhalers for asthma. Asthma is one of the most common allergic diseases in both children and adults, and inhalers remain the cornerstone of treatment. They are well established, extensively studied, and proven to be safe and effective. While I've previously covered nearly all FDA-approved biologic therapies for asthma, this series will shift our attention to inhalers, introducing them one by one. We'll begin with Spiriva Respimat, an FDA-approved inhaled long-term therapy used for both chronic obstructive pulmonary disease, also known as COPD, and asthma. Spiriva Respimat is taken once daily and is designed as a maintenance medication to keep airways open every day. In this video, I will walk you through 5 key things you need to know about Spiriva Respimat: what it is, how it works, how to take it, important warnings and precautions, and what we know about safety. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Spiriva Respimat and who it's for? Spiriva Respimat contains tiotropium, an inhaled anticholinergic bronchodilator approved by the FDA for long-term, once-daily maintenance treatment of COPD and asthma. It was first approved in September 2014 for COPD. In September 2015, its indication expanded to include asthma in patients 12 years and older. And in February 2017, approval was further extended to children with asthma as young as 6 years of age. One critical reminder is that Spiriva Respimat is not a rescue medication. It should not be used to treat acute asthma attacks or COPD exacerbations. And patients should always have a short-acting rescue inhaler available for sudden breathing problems. The role of Spiriva Respimat is long-term control, helping improve lung function and reduce the risk of exacerbations over time. Second, how does Spiriva Respimat work? To understand how Spiriva Respimat works, it helps to briefly review how airway tone is regulated. Airway smooth muscle is partly controlled by acetylcholine, a neurotransmitter that binds to muscarinic receptors, particularly the M3 receptor. When acetylcholine activates these receptors, airway smooth muscle contracts and gland secretion increases, resulting in airway narrowing and mucus production. Tiotropium is a long-acting muscarinic antagonist. It binds to muscarinic receptors in the airway and blocks the effects of acetylcholine. By functionally inhibiting M3 receptors on airway smooth muscle, tiotropium provides sustained bronchodilation. This mechanism is especially important in COPD, where increased cholinergic tone plays a major role. However, tiotropium can also provide benefit in asthma when added to inhaled corticosteroid-based therapy. Third, let's talk about dosing and how to take Spiriva Respimat. Spiriva Respimat is used for oral inhalation only and should be taken once daily at the same time each day. Patients should be careful to avoid getting the medication mist into the eyes, as this may cause blurred vision or pupil dilation. Spiriva Respimat comes in 2 strengths. The blue labeled inhaler delivers 1.25 micrograms per actuation, while the green labeled inhaler delivers 2.5 micrograms per actuation. Each daily dose consists of 2 inhalations resulting in a total daily dose of either 2.5 micrograms or 5 micrograms, depending on the indication. Patients should not exceed 2 inhalations in 24 hours. For COPD, the recommended dose is 2 inhalations of the 2.5 microgram strength once daily, for a total of 5 micrograms per day. For asthma, the recommended dose is 2 inhalations of the 1.25 microgram strength once daily, for a total of 2.5 micrograms per day. In asthma, maximum improvement in lung function may take up to 4 to 8 weeks of consistent use. Spiriva Respimat should not be used together with other anticholinergic medications, as this can increase the risk of anticholinergic side effects, such as dry mouth, constipation, urinary retention, and increased heart rate. No dose adjustment is required for liver or kidney impairment. However, patients with moderate to severe kidney impairment should be monitored more closely for anticholinergic side effects. Proper inhaler use is essential. The Respimat device produces a soft mist rather than a forceful spray, so preparation and inhalation differ from traditional metered dose inhalers. Correct priming, inhalation technique, and consistent daily use are key to achieving full benefit. Detailed instructions are available in the Instruction for Use section of the package insert and on the official Spiriva website. Caregivers should assist children when using the inhaler. Fourth, let's review important warnings and precautions. Immediate hypersensitivity reactions, including anaphylaxis, have been reported with Spiriva Respimat. It should not be used in patients with known allergies to tiotropium, ipratropium, or any ingredient of this product. If symptoms such as hives, swelling of the lips, tongue, or throat, rash, itching, or breathing difficulty occur, the medication should be stopped right away and emergency medical care should be sought. Because tiotropium is structurally related to atropine, patients with a history of atropine hypersensitivity should be monitored closely for similar hypersensitivity reactions to Spiriva Respimat. Sudden worsening of breathing, known as paradoxical bronchospasm, can also occur with inhaled medications. If this happens, it should be treated immediately with a short-acting beta-2 agonist, such as albuterol, and Spiriva Respimat should be discontinued. Spiriva Respimat should be used cautiously in patients with glaucoma, as it may increase eye pressure. Symptoms such as eye pain or discomfort, blurred vision, seeing halos, or colored images along with red eyes should prompt immediate medical attention. Because dizziness or blurred vision may occur with Spiriva Respimat, patients should use caution when driving or operating appliances or machinery if these symptoms develop. Caution is also advised in patients with urinary retention, particularly those with prostate enlargement or bladder neck obstruction. Difficulty urinating or painful urination should be reported promptly to the doctor. And finally, let's review side effects and safety. In COPD clinical trials, the most common side effects included sore throat, cough, dry mouth, and sinus infection. Less common side effects consistent with possible anticholinergic effects included constipation and urinary symptoms. In asthma clinical trials, the most common side effects were sore throat, headache, bronchitis, and sinus infection. Because the same active ingredient is used in both asthma and COPD, similar side effects may be seen across both patient populations, regardless the dose. In children and adolescents aged 6 to 17 years with asthma, the safety profile was comparable to that observed in adults. Post-marketing experience with Spiriva Respimat, and the earlier formulation, Spiriva HandiHaler, has included additional reported adverse events. Although it is difficult to determine how often this occurred or whether they are directly caused by the medication, these reports highlight the importance of stopping the inhaler and consulting a healthcare provider if new persistent or worsening symptoms develop. And there you have it, 5 key things you need to know about Spiriva Respimat, a once-daily, long-acting anticholinergic bronchodilator approved for maintenance treatment of COPD and asthma in patients 6 years and older. By targeting muscarinic receptors in the airway, it provides sustained bronchodilation, supports lung function, and helps reduce exacerbation risk. While it does not replace rescue therapy, Spiriva Respimat remains an important option in long-term respiratory disease management. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.